This hospital was founded in around 1920, 1925, and is the third largest Italian hospital, and in terms of complexity, a couple of years ago was the first hospital for case mix. Is 1,000 standard beds plus 200 beds for day hospital procedure, and is a referring center for transplantation, advanced surgery. I do personally believe that optimization of care, optimization of cost is not free of cost. So in order to cut by 20% the cost, you have to invest something. To have a patient in non-invasive ventilation in the floor that then needs ICU admission and needs to be ventilated with non-invasive ventilation must have an ICU ventilator able to provide non-invasive ventilation in the ICU settings. To have advanced form of monitoring that are compatible in the OR and in the ICU is extremely important. And this is always true, but is particularly true for this hospital that has an important percentage of the total workload coming from patients that require advanced and aggressive surgical procedures that must be treated immediately after the end of the surgical procedure in the ICU. So to maintain a continuum in the different area, providing the same quality of care in terms of workflow is extremely important.
The ability to provide the same type of ventilation in the operating theatre as in the intensive care ward has been of considerable assistance, particularly in the case of lung transplants or lung operations, or when undertaking highly complicated surgical procedures. Dräger is undoubtedly one of the companies with which we have worked most closely since I started working here. It's certainly one of those companies which I consider to be a market leader with respect to anaesthetic equipment in operating theatres and ventilation equipment for intensive care.
The results of large randomized clinical trials tell us that if you optimize ventilatory strategy in terms of using protective ventilatory strategy, in terms of use of non-invasive ventilation whenever it's possible, in terms of use of physiologically oriented winning strategies, you obtain an improvement in outcome. The technology that we have fulfill these three criteria. So there is a direct benefit for the patients because we are using the standard of care.
This means that the most important criteria, even though many others are also significant, the main parameters when we assess a piece of technology during the procurement phase are the safety and the technical support. High-quality technical support is essential. The reliability of the equipment ensures that a high level of availability can be maintained. In other words, having technology at your disposal with high MTBF, mean time between failures. These are therefore the criteria which guided our decision-making to choose Dräger technology and continue to maintain a positive evaluation of the equipment right up to the present day.